Then is it good? Is no school strategy? Okay, that's what my mom. That's my aunt. That's right over Yeah, we're I'm really good at big sandwiches. And we'll start early.
I think it's here.
Good evening, everyone. Good evening. Hi, my name is Deanna Gibson, and I am the minister here at Trinity United, and it's a pleasure to welcome you all this evening. Thank you so much to Reach Out Chatham Kent for joining us, and we're looking forward to all the wonderful wisdom that you are going to share with us tonight. This is our first presentation in our Building Strong Community series, and we're going to take a little break in July and August and then come back in September. Just a couple things to note. There are washrooms out this door along this hallway, washrooms past the kitchen, and for any friends who were not able to be here tonight, we will be on YouTube, so you can tune in that way as well. Oh yes, and another important detail, there are treats after this evening. I sampled maybe a couple, and they're all very good. So, all right, thank you.
Hello, bonjour. My name is Jordan, and I'm so lucky to be here tonight with this awesome team. I work for the Chatham Kent Ontario Health Team as the Community Drug Strategy Coordinator. And as part of that work, I'm so privileged to be able to partner with and work with and volunteer with Reach Out Chatham Kent. So we'll introduce ourselves here in a minute, but we're going to start tonight grounding, beginning in a good way with a land acknowledgement. So R.0.C.K acknowledges and works with a lot of people who experience challenges related to substance use and to houselessness. And the land that we are on is really, really important to our work and our relationship to the land. It is people's homes. People use it to survive. And we know that people who experience substance use, who are Indigenous, experience harms and risks in different ways compared to other populations. And that's not because they are Indigenous, it's because of the ongoing historic and current harms related to colonization and genocidal policy. On the flip side, Indigenous peoples have so many strengths, gifts, and so much that we can learn from their approaches, ways of being and knowing. And R.0.C.K is so lucky to be able to partner with our First Nations communities and with a number of Indigenous-led organizations and groups to learn and unlearn and understand how in our work we can do better as part of our own reconciliation journey. And really for us, I think a big part of that is about relationships, relationships with people, relationships with the land, with all living things. So we gratefully acknowledge that the land that we are gathered here on today belongs to Indigenous peoples, the Odawa, Potawatomi, and Ojibwe nations, which make up the Three Fires Confederacy. The Anishinaabe, as well as the Lenape, and our community that is colonially referred to as Chatham Kent, neighbors to First Nations communities, Ilanape-Lilakiwait, Delaware Nation, and Bekejwanang, Walpole Island First Nation, which is unceded territory, which means that it was never surrendered, never part of a treaty. And we know that Delaware Nation is part of McKee Purchase Treaty or Treaty 2, as well as the land that is now called Chatham Kent. And it's an ongoing process, right? So reconciliation is ongoing. There is no endpoint or end destination. This is work that we continue to do. We need to continue to show up for, and it's work that we have to do together. So settlers, ships, and canoe, so Indigenous people working side by side together. And we acknowledge each of you, your reasons for being here, your unique identities. We are truly better as a community when we are together. So welcome. Thank you for being here. Thank you for showing up and having the courage and willingness to learn with us tonight. Another important part of the work that we do and when we do presentations and talks is to acknowledge this as a safer, braver space. So people come to conversations about substance use from all different lenses and perspectives, right? And we all bring our unique experiences with us to these conversations. And that's what makes this work so beautiful. But it can be really hard sometimes to have these conversations. You may yourself have experienced struggles with substance use. You may know someone, a loved one that is going through that. So we welcome you, invite you to do whatever you need during our talk tonight to self-manage. If you need to get up, stretch your legs, go for a walk, go take a breath outside, take a pause, take some deep breaths. There are some resources and supports on the table just outside of the doors there. We also usually bring with us, we have some coloring materials if you feel like you need to distract after this. There's some rocks on the table. Sometimes it feels good to take a rock and just have something to help ground you to the earth and connect that way. So welcome you to engage with any of those supports there. We are also happy to stay afterwards if you would rather talk one-on-one, or if you feel like you need to debrief or unpack anything that we talk about. Sometimes it can be hard to ask questions in a group, especially a group of your fellow community members, right? So our contact information is on the resources that were at the table when you came in. If you would like to connect at another time separately from this event, happy to continue the conversation that way as well. And we really do hope that tonight will be a conversation. So when we come to these types of events, I think we find we learn just as much from you as hopefully you will learn from us. So really hoping to have a dialogue, hear your questions, learn from your experiences as well. So we're really, really happy to be here. And I think I'll pass it to Albert to introduce himself.
Good evening. My name is Albert. I'm a peer, basically a wanderer. I go around to different places in the community and try to help out the best I can. With that, I'll pass it to Sean.
Hi, I'm Sean, and I'm a pathfinder for R.0.C.K, and I go around and I'm social with all the people, so I get connected with them all.
I'm Sam. I'm a peer pathfinder and I bake at Rock Missions. Okay.
She does more than that, but that's okay. I'm Colleen Lewis, and I am a volunteer with R.0.C.K for the last 5.5 years. Started as an outreach volunteer, and then was invited into the peer community of support, and been doing working with peers for now 4 to 5 years. Also on the board. That's about the most boring part.
My name is Jennifer Richmond. I am one of the peer, or actually I am the peer coordinator again. And my role, I've been with R.0.C.K for 4 years, got invited to help oversee their peer program, to support the peers, and we've been growing and building since then. My name is Amanda Vankerkoven. I am one of the co-leads at the Wallaceburg Drop-In Center, the Wallaceburg location, and I have been with R.0.C.K for about 2.5 years.
Hi there, I'm Lisa Med. I'm the other part of the co-lead at the Wallaceburg Drop-In Center, and I've been with R.0.C.K on and off for about 3 years.
I'm Lori Leffler. I'm the Wallaceburg Community Outreach Worker. I've been with R.0.C.K for almost 2 years, actually.
I'm Shauna. I am the operations coordinator for R.0.C.K in Wallaceburg, and I've been about a month in.
All right. Thanks, everybody. Jen's going to scribble some stuff down for us here.
As long as they actually have some ideas.
We would love to hear from you.
So what we're wondering, you might have heard, you saw the announcement, you might have heard the radio ad, but we're just wondering if you're willing to share or courageous enough, what would you like to learn tonight? What would you like to hear? We have an agenda of some ideas of what we're going to talk about. We're going to touch stigma. We're going to talk about interacting and engaging with individuals that might be on the streets, living homeless. Is there anything that you came with that you would want to make sure that we touched?
Can you bring me up to speed on kind of the history of R.0.C.K in Wallaceburg? You were very involved, and then there was a period where you were not, and then you're back, which is really good. And I'm actually looking for A, the history, and B, what we can do to make sure that we never leave Wallaceburg again.
Anybody else? Go ahead. Oh, spit it out. Okay. Yep. Which we know is a reality. Yep. So she inquired how to deal with neighbors that might be either squatting, trespassing, might be living in your neighbor's shed, a bunch of different scenarios. Yep. Go ahead. Okay. Perfect. I for sure can, yeah. So the inquiry, and I'm printing small. So the first one was just asking about the history of R.0.C.K in Wallaceburg, so the drop-in center. So we'll dive into that. So the R.0.C.K staff, Colleen, could be a part of that ground piece. Ways that we can help, we can talk about those pieces, dealing with our neighbors that might be experiencing homelessness and substance use, along with just what are the resources, what's available out there right now. Yep. Anything else? What do we need? All right. Oh. Okay.
I'm not sure if mine is an answerable question. How do we become equipped so that those in society who see voter R.0.C.K as being not good enough, how do we become equipped so that we see people as good enough?
We are going, thank you.
just summed up our whole talk today, I think.
And I'm there. Yeah. Is this a good start? And we're going to have questions at the end. So if something pops up when we get there, we'll play with whatever we can as we go. So we were going to start, Uncle Sean. So Sean and we're going to talk a little bit about R.0.C.K and R.0.C.K in the sense of where it started, being Chatham. So it literally started with two males seeing a need, took some sandwiches out, and met people exactly where they were at. And from there, it grew from 12 sandwiches to Chatham does 300 lunches. We were 2 days a week, but as we transitioned, we've gone down to 1 day a week as a large outreach. So R.0.C.K started at United Way. We had a space there. We met there. That's when I was invited in. I jumped a lot of history. But then we worked out of one little room at United Way with Renee. And from there, we had the opportunity you guys landed in Wallaceburg first before R.0.C.K in Chatham had a drop-in center. So the drop-in center existed in Wallaceburg before Chatham. Chatham has now been open for 2 years, turnkey this August for 2 years. And how would you describe the house, Uncle or Sean?
It's a place where they can come in and relax, and we feed them, and if we can provide them with clothes and stuff like that, they can come in and have a shower and just get socialize with other people and themselves. And they help them with certain needs that we can provide for them in that, like health cards and stuff like that too, right?
So one of the individuals at yesterday's presentation, she's like, can you please tell them it's an actual house? So when you walk up the front steps, so R.0.C.K's drop-in center in Chatham is a house. So when you walk up to the steps, you open the front door, there's a little living room space with chairs that people can safely
relax and watch TV or just mingle with people.
Yeah. And then the next space is basically a kitchen area.
Yeah, a kitchen, and then our office for supplies and stuff like that they need. And then we got the garage.
The shed of mystery.
Yeah.
But that's the unique part with the Chatham space is that it's described as a house. People can come, sit, rest, relax, recharge.
Yeah.
But with that, so we're open, that location is open on Wednesday, Thursdays, and Fridays. Tuesdays, we do the large outreach where the team goes out to the 300 some locations, people that we serve. But in addition to that, with some partnerships that we have, you're a part of that.
Yeah, our satellite parts too.
Well, yeah, but I'm talking about the 7-day outreach.
Oh yeah, I go out and do outreach where I go out sometimes by myself and I talk to them and socialize with them and see what they need and if I can help them in any which way, or R.0.C.K can for sure, and get to know them and find out what help they can give them.
Right. So we go out 7 days a week to the encampments, locations that have been identified to us, or even houses that we know that people are precariously housed. So we do have locations, where 20 some people might be residing in one location. In addition, you mentioned health cards. We do health card runs, getting people's ID replaced. If your backpack carries your life, if you nod off, if you just walk away from your backpack, you could lose your whole entire identity in one very quick. So
which happens a lot.
Very unfortunately. Yeah. But what happens on Wednesday at the house?
Wednesday is open
I'm putting him on the spot.
Yeah. Wednesdays it's peer night.
It is, yeah,
And
yeah.
then the people come in and they can hang out and we do art and just mingle with everybody and get them involved in different things. Some things that's different than others.
Yes.
Like fish and meat.
So also before, in the evening, we have a partnership with the community paramedics. So that location, it happens also in Wallaceburg. You guys have Mondays? Every other Monday. Okay, so twice a month, they visit the community paramedics. So we have paramedics. So that piece that we're going to talk about, stigma, a lot of our friends do not trust anybody in uniform, first responders, just healthcare systems. So we have seen huge bridges being made with the community paramedic program. So the community paramedics sit in the house, individuals can come and receive any type of services, checks, I think like prescriptions being prescribed, getting sent to, we've had ambulances called because we're like, oh, we need more help here right now.
Yeah.
What else would you say?
You almost got it all.
So with Wallaceburg is open 5 days a week. And again, the community paramedics go there, but they also have access to peers just to talk things out if they want to access a service, right? And I think that's what's so great about the peer work that is being done. And we have staff too that can, if they want to start a housing application, if they want to talk about going to an addictions program, or if they just want to talk about how to use safely,
or to go with them too.
and go with them to these appointments. So whether that's Ontario Works or Ontario Disability, whether it's their doctor's appointment or the hospital.
Yeah.
So it's peers walking with. So both in Chatham and Wallaceburg, we do have, like Lori said, an outreach housing worker piece where you can talk to persons that are having struggles whether they're out on the street or whether they're just crashing on somebody's couch, on how to make the next step a little better.
They do a lot of trust in us, so we can get them to where they want to go and stuff like that.
Some people won't go to the doctor's appointment without a peer. Some people won't go to their lawyer's appointment. They won't call their court support workers or anything unless they have somebody with them, because they feel so isolated. So yeah, all the peers definitely, and the trust that is built is how the R.0.C.K was founded, is building that relationship. I'm just trying to look at. Yeah, what else is happening in Wallaceburg?
Wallaceburg location is open 5 days a week. We are open Mondays, Tuesdays, Thursdays, Fridays, and Saturdays from 1 until 5. We are closed Wednesdays because that is our outreach day. We have some staff members that go in, prepare 120 lunches, and then our outreach team comes and brings them out into the community. We are a safe space, a judgment-free space for people to come and sit and land and just be. We serve a meal every single day. There is unlimited juice and coffee and tea. In the hotter weather, we have freezies, and these people have built a community in and amongst themselves, and they sit and they visit and they support each other, and they look for support from us.
I'm pretty sure she caught most of that. I don't really have anything to add. As Amanda said, it's a safe space for everyone to come. Some come and just take their food to go. Others come and go several times through the day. There's other people that do come and stick around for the entire day. They play some music on the TV that I can do without, but I'm old. Yeah.
What I'd just like to add is that they have access to ask, and just Amanda was talking today about somebody they're having a difficult time and they are, they could be calling a lawyer or advocating, and they have access to themselves. They have access to Lori and other individuals that they can just make a phone call. If they don't have a phone, they can use the computer. If they do not have clearly access to internet, and they can just rest and feel that they can talk to somebody and have access to it. So that's a huge piece that on average, I'd also like to say the numbers are running between 35 and 50 people in a 4-hour period. It may not be known to everybody, but that if you look at some of those are coming 5 days a week, some of those are new faces, and some people come in and out very quickly if they just want their basic needs met and then leave. And it also is air conditioned from the very sweltering weather and a warm place to go. We also provide supplies at both Chatham and Wallaceburg. And we say, I'm just jumping to some of the questions is, needs are basic needs, and these are more frequently, it has been tarps and tents. It goes from harm reduction supplies to wound care kits. And food. It can be socks and underwear, which we're low on. So it's just, it can be all those just little things that you take for granted, whether it's a bar of soap, a toothbrush, etc. And shoes, because folks that are walking around all the time are going through shoes more frequently than us, and they're needing a good solid shoe. But we provide those as best we can within our limitations. Where are we going next? I just want to
I
make
was
sure we're
just going
answering
to
questions.
comment on the question about the history with Wallaceburg. So initially, the Wallaceburg drop-in site, I believe, was created literally over a Christmas break. It was brainstormed. We worked throughout Christmas and was because of like the cold and the extreme weather conditions, and Wallaceburg not having a lot of the other resources and supports that were available in Chatham. And I think some funding became available, and it was a whole group of different partners that came together at that time. And R.0.C.K kind of served as the backbone organization and the operational lead for
And some of
the
those
site.
people could be in this room right now. I'm just looking around at that time
Mhm.
because it was James Street Church that was approaching United Way and the municipality, and it all came together and it opened right over Christmas break.
Yes.
So it would offered daytime, and then we offered some evenings at that time because again, that was still during the pandemic. So there was different pandemic supports at that time. So that's how it started. So we were talking about how it started, and then for multiple reasons, including funding and pricing, we did have to move the program at that time over to Skinnaw due to just some big funding pieces, and then it was just another collaboration, thinking if we could have our own space, and we moved from Skinnaw over to Nelson Street. So there was a period of time in there. There was a few months where there was this decreased hours. There wasn't as much support in Wallaceburg. So we were never gone. The outreach was still happening, and we've never missed an outreach in Wallaceburg on a Wednesday night. I know they've postponed a few hours. The outreach is on Wednesday nights. They're literally going to like 30 different places where people congregate or live outdoors, but that never stopped. We've always served the most vulnerable. So that is our mandate, is that we serve those who are unhoused or precariously housed, and persons that use substances. We're here to meet people where they're at, and that has not stopped in Chatham or Wallaceburg in the whole time. We never miss an outreach, even with the most crazy weather. Our volunteers and are absolutely incredible, and put other people's needs before their own, which I really promote safety, and they don't listen. We just keep going forward. So there was a time where it felt like moving from Dream Street to Scunnaw and then back here, that there was a time where we did close. It wasn't good for the persons that we serve at all. And now that being there in the core is helpful. I mean, we also had the question about how to serve best individuals that struggle on the street, but it has served as a good home there on Nelson Street.
And I just really want to quickly touch on what outreach means, because it means different things to different people and organizations. For us, it is quite literally like street health, mobile outreach. So a team of staff and volunteers going out in their vehicles, packing up bins of supplies, food, clothes, harm reduction materials to promote safer substance use, the tarps, blankets, socks, shoes, all of those things, first aid, hygiene supplies, all of that. And the outreach model is a really low barrier way to be able to connect with people in community where they already are. So rather than asking them to come to us, which, kind of centers our own needs as an organization, we take all that away and we go to them in their environment, on their turf, on their terms, kind of thing, which takes a lot of trust and relationship building for that to happen. And that is a huge piece of why we work with peers, and why so many of our services are peer-led, peer-driven. So working directly with people from within that community who already have those relationships, who already have those connections. For me, I'm a public health nurse by trade, and if I were to go on outreach and try and offer someone some support with wound care, for example, and I was just meeting them for the first time, it would maybe take me 5 or 6 times of going and asking and building some trust before I was able to even maybe look at that person's wound. But if Sean were to come out with me, or Sam or Albert, and to be able to say, hey, she's okay, you can trust her, I've had that experience, and that almost immediately gets you into the door and able to support. So peers quite literally open doors. They're able to contact people, find where people are, make sure that we stay in touch with them, that they're safe, all of those things. And Sean also mentioned satellite sites. So another piece of what we do, we have drop-in sites in Chatham and Wallaceburg, but there's many other communities across Chatham Kent that have limited access to services and supports when it comes to substance use, and in particular harm reduction. And there's folks within those communities that are already doing this work from within their homes. That's what a peer is. They're a caregiver, they're a leader in the community, they're someone that takes people in, cares for them, someone that people trust. And so, for example, in Bothwell, in Ridgetown, Dresden, in Blenheim, we've been working with people with lived and living expertise, peers, who from within their homes offer what we call satellite site services. So they provide naloxone kits and health teaching to individuals, first aid and wound care supplies, other harm reduction supplies. They can make referrals to community services, and we support them to be able to offer that service in a way that works for them out of their home. So it's a really cool, innovative approach that we learned from Toronto to try and increase access to services in a way that's really, that feels a bit safer for the folks that are going there, because they feel better, they feel safer going to a peer than they do going to a hospital or going to a municipal building, for example. So meeting them where they're at, where they're already going. And it's probably a good time to share the peer video. Yeah.
a peer pathfinder. We are an ear for anybody that wants to talk.
All of our services, the work that we do, it's informed and it's led by people with lived and living expertise of substance use and houselessness.
We're there to build trust and relationships.
If they do ask for help, at least we can guide them in the right direction.
We can help them with resources that they don't know.
Offer services, offer connections, build relationships.
If you say you're going to do something, you do it. Everybody needs that in their lifetime. They need to know that they can count on somebody to be there for them. Everybody's brought on earth for some reason, and mine was just to help people, I think.
Albert's going to share a few words with us now and teach us a little bit about stigma.
Good evening. It's an honor and privilege to be here tonight. My name's Albert, and I'm an alcoholic and an addict in recovery. I have a little bit of a different perspective on stigma because I've been there, and through my journey, I started drinking when I was in probably grade 8. It wasn't an everyday thing, obviously. I started doing drugs in high school. That went on typically as we do graduate. You had to continue to party for a while, got married, and that kind of settled me down for a while. Now, at this point, I was a proverbial functioning alcoholic, in my opinion. I had a couple of businesses, vehicles, all this stuff that society says makes us happy. But once I had my children and settled down, and I substituted my addiction and my alcoholism and became a workaholic. I continued on for many years, and in 2015, I had an MRI, and they told me to stop doing what I was doing. At that point in my life, I could not, because I still had 2 children in university. So I continued to do what I was doing as far as work goes, although my alcoholism and my substance use and abuse continued to grow, just to cover the pain possibly, or to mask it. In 2020, I had another MRI, and they told me if I kept doing what I was doing, I could end up with serious complications. So at that point, now you've taken away my work, and what was a habit became the profession. I began isolating by myself, consuming alcohol and substances by myself. Got to the point where I wasn't even sure how to communicate, at least from my perception. I tried talking to my doctor and some of the psychologists, tried the RAM clinic, and none of that stuff worked. So continued to beat my head off the wall for another 2 years. And finally, I say, but for the grace of God, I happened to Google one of the 12-step programs on my computer. And I don't know how, I don't know why. I don't have to explain it. I can't explain it. I just accepted the rest of my journey. And I've been sober and clean for a little over 2.5 years now. But no, it's a beautiful thing, and I thank you very kindly. But through that journey, there was people outside of one of the 12-step groups I go to. And for some particular reason, without judgment, I happened to talk to them, and I was suggested through conversations that I go to the RAM clinic. So I went to the RAM clinic, and they gave me some supplies to take back to these people. And they suggested I go contact R.0.C.K. Now, at this point, I'm riding my bicycle because Big Brother said I couldn't drive because of my alcoholism, and we can assume what happened there. I'm just grateful nobody was injured. So I hooked up with the RAM clinic when they were out on McNaughton and Bloomfield. And I would just ride my bicycle out there on a Saturday, they would load me up with stuff, and away I'd go pedaling off into the wild blue yonder. And I would go and meet these people where they were at and try to give them clean supplies and wound care kits and whatever I could carry on my bicycle in my bag. And that's where my journey began. And through that, I had to navigate the Ontario Works, ODSP, CPPD, and all these things. And I guess this is where stigma comes in, because as a substance abuser and an alcoholic, we're afraid to confront anything. And to even walk in the doors of a government building or something like that is very, very difficult, because we've been looked down upon all our lives. And if anybody thinks this is a choice, it is not a choice. This is a non-discriminating, deadly progressive disease. I didn't wake up one day and say, holy crap. This was over a number of years that this addiction and alcoholism took over my life. So only thing I ask of anybody that sees somebody out there, have some empathy and compassion. We have no idea what their backstory is, whether it was child abuse, spousal abuse, mental illness. There are so many traumas out there that are unrecognized by the public. And society created a lot of it ourselves with the opiates that we prescribe people, and take them away from these people. And they're in full-blown addiction at this point because we gave this stuff to them. And now they're trying to find it on the streets at absorbent prices. So then they substitute one drug for another. And this is just to stop the pain of withdrawals. And the thing about my journey, if somebody does ask, I can share what I had to do to get clean and sober. And I suggest they can go to the RAM clinic. It's a walk-in clinic in Chatham where they can walk in and actually talk to somebody. I've met people there. I still go there, and people walk through the doors, and I get to sit there and shake their hand and say, how are you doing? Great to see you here. Because you know that perhaps they're taking the appropriate steps towards recovery. So with that, I'm going to say I love you all. Thank you for being part of my journey. If there's anything else I could answer for you, I'd be more than grateful to do that. So it's rapid access to addictive medicine. So they can go there, and there's medications you can take to try to alleviate the opioid withdrawals. And they have guidance and help there through nurses and health practitioners, as well as lady I talked to, I still do 2.5 years later, just about life and what's going on. And if I need help with anything or something's bothering me, I can talk to her one-on-one. You know, it's anonymity. It's not going to go any further, because I couldn't do that when I was practicing, because I was considered a weakness to actually share with emotions and ask for help. So I know it's a great part of my journey, and I'll be forever grateful for the ladies in there. Oh, it's Chatham at the hospital. It doesn't have a sign on the outside of the building. It's just addictions.
Yeah, it just says addiction supports on the outside. It's a purple sign. Yeah. But for resources in Wallaceburg, the Rapid Addictions Medicine Clinic is in Tuesdays in Wallaceburg, 1 to 4 on Tuesdays. So that same Chatham support is in Wallaceburg, as well as there are multiple other resources such as the methadone clinics that are also in Wallaceburg too. I give access to that support, and so does the Rapid Addiction. So the RAM clinic is in Wallaceburg every Tuesday. Okay. So yeah, we do try, and whenever we're talking about Chatham, like how is that replicated in Wallaceburg? So it is there. So those same individuals work in Wallaceburg. Thank you, Albert, for sharing, and really, hit all the stigma pieces, especially the compassion approach. Thank you.
So just to expand and tease out some of these concepts a little bit, so we all have an understanding from where we're coming from. Substance use is different for everyone. Everyone's journey and relationship with it is different. People use substances for all kinds of different reasons. And sometimes it's really normal. Sometimes it's okay. Sometimes there's benefits to substance use, right? Like often when we hear the word substance use or substance misuse, drug misuse, really negative images and preconceptions come to mind, right? And that happens for me too. I've worked in this area for 10 years now, and I still have to correct myself and challenge some of those thoughts that come up. And we all have stigma, right? We have all been conditioned, educated, exposed to really harmful misinformation and narratives and rhetoric in the media, in our school system, in even in the ways that we talk about it in healthcare spaces and in other service settings. And what we know in the work that we do and what we know from research is that language and how we talk about substance use really, really matters. Language is a really powerful tool, and it's something that's really actionable and simple that we can all do. It's a tool that we can all use wherever we are to help foster safety and to help build trust and help people feel seen and heard. So at R.0.C.K, we try to use what we call person-first language. So this actually comes from the disability community, and harm reduction has sort of borrowed it with permission. And when we're talking about a person who uses substances, we say they are a person who uses substances. And we do that to honor that they are a person first and foremost, right? They are a whole being. Substance use does not define them. It is maybe one thing that they're going through, or something that they choose to do, or something that helps them get through the day or survive something really difficult. But it doesn't define them. And there's so much going on beneath the surface, right? Like we often use an analogy of an iceberg, and some of the things, some of the challenges that we see out in the community on the street, the really visible signs of substance use, that is just the tip of the iceberg. We have no idea what's going on underneath and what has led that person to that point. So that's one small thing that we can all do, and an action that you can take away from the conversation today is just to try and reflect and notice a little bit more when you're having conversations with your loved ones, with your family and friends, when you're watching a show on Netflix, what have you, just to notice how our society, how our culture talks about substance use, and how that might contribute to experiences of mistrust or feeling unsafe or feeling excluded for someone who uses substances, and how that can actually affect their ability to reach out and ask for help. And we know that the way that we talk about substance use in healthcare, the way that we document, the way that we chart about someone who uses substances actually affects the care that they receive. So when we talk about it from a place that is more compassionate and comes from a place of seeing that whole person, they receive better care and they have better health outcomes. They do better in the long term. When we use really harmful labels, when we judge people, when we, force people to go through really hard things in order to be eligible to receive treatment or just be able to walk through the doors. It doesn't make a lot of sense, and it doesn't actually work very well. We get a lot farther with people when we treat them like human beings, and when we come from a place of understanding and compassion.
I was going to say we participated in a survey gathering some information from the municipality, and when we brought it back to our peer table to get them to look at the questions, and this goes back to that simple piece that sometimes we think we also know the answer or where that person or what they need. And Albert was a very strong voice when we were going through these survey questions, because we were like, how do we keep someone housed? How can we just get them to recovery or using or to a detox location? And Albert's like, whoa, let's back up. Do they even have ID? Do they have a phone? Can someone leave a message for them? There were so many missing piece steps that we don't have the resources or the funding or just the way the system is set up right now, that people just can't go out and get a job because do they have an address to write down on their resume? They might have a criminal record. So could they pass a vulnerable check? Are they going to have anybody vet for them to rent a location? Do they have first and last month's rent to begin with? So there were so many little pieces that I think we at R.0.C.K try to help with. But when it comes to that stigma, because we often get that question, or people like, why can't, or like I've done this for a couple years, and family members, why don't they just get off the drugs? Why don't they just go out and get a job and get off the system? That is such a complicated, complex piece that our society does not have a lot of the framework to even come along, where I know a lot of us, even sitting here, we all have, we talk about masks sometimes, and we all come and we might look like we're put together, or that we might have things there, but many of us might be one paycheck away from being the next individual that could be living in their car. And you might even have family that you're not even aware of that could be living in a car at this stage, to then the next step, they could be into a tent because their vehicle has been seized, and it's been in the compound. So so that stigma piece of, you don't really know where people are. And if you just, in that sense, take an awareness piece of your own self and just say, how do I want to be treated? How would I want to be engaged? So it even comes to, I know what people feel really uncomfortable if someone is sitting outside the grocery store with a sign. And I had a conversation with someone in the grocery store, like, I'm not going to give them money. You know what they're going to do with it, Jen? And I'm like, that's not really my choice, but it's your choice if you want to give them money, but maybe ask them what they need. And a lot of our friends even say the simple thing, can you just make eye contact? To acknowledge that I'm actually a person and I am human. That you're not just walking past them, but a lot of it's our own uncomfortableness, right? And you have to do what you're comfortable with too. So you don't have to engage them if you're not comfortable, but making simple eye contact and just saying, hello. In a way, it shows that I see you. You are there. And then we often say, can I reach out? And that was one of the things, what is a resource? Some of the times I'll be like, if I see someone that I don't recognize or I haven't known, it'll be, can I get you connected? So like for Wallsburg, I'm just thinking, if someone is outside a storefront right now, here, you're like, are you aware of R.0.C.K? I can get you connected to Lori. Lori can come meet you. Can I let Lori know where you are at? And then you are more than welcome to call our Rock phone in Wallaceburg. And if Lori is working that day, or I even know Amanda, Lisa will go even and meet someone where they're at, just to make that connection. So we can be that bridge for you, that you don't have to take on that piece either. We do have cards, and yep. Well, they're Blenheim, or not Blenheim, sorry. They are Chatham and Wallaceburg's numbers on them. Yeah, yeah.
Just to add the surveys that you were talking about, that was part of my job, was getting those filled out. And it, when you say just acknowledge, I can't remember exactly what the question was, but going through them with a lot of our friends, hearing so many responses of just to acknowledge and say hello or a smile. Like if you don't want to start a conversation, just a smile and what it can do for someone, even for any of us, when we're having a bad day and we're out and about. Sometimes all it takes is someone else to smile at you. Well, our friends desperately feel that way. And I'm sure just as much as our friends in Chatham, our friends in Wallaceburg, just to be seen, and that we can't forget they are human beings and they deserve that same kind of kindness that we would expect from others.
Is this on? Oh. Yeah, just first, I'll touch on the stigma a little bit again. Like, I don't know how many times I heard, why don't you just stop? My gosh, how many times have I told myself, why don't you just stop? Until I started to get sober, I didn't realize it, but this is a disease. And I can't get better alone. That's why it's so valuable for us to be out there communicating with these people and showing them some empathy and compassion. I know we're supposed to treat your neighbor as yourself. At one point in my recovery, I didn't even, or previous to recovery, I didn't even know how I wanted to be treated anymore. It didn't matter. My life didn't matter. I mean, that's how low we can get as far as self-loathing and self-pity and how did I get here? So, like I say, it was not a choice. It wasn't a decision that any of us made. And if we could just stop, we would. I guarantee it. But that's why I've like to be out there for my heart, to at least be there for somebody, just in case. You never know.
Can you give us an idea of how many people are successful, like Albert that you deal with, or how many people achieve having a residence of some sort?
So I'm going to unpack your question a little bit, I think, because it's complicated. I think we have all learned in our different journeys with R.0.C.K that success looks different for each person. And part of it is redefining how we view success. Because for me, I would absolutely love to see every single person stably housed and supported with wraparound mental health, substance use treatment, food security, all the things. But some people aren't there yet. Some people aren't ready. And that comes with like many, many reasons for that. So sometimes success is just someone actually walking through our doors for the first time and connecting with our services. Sometimes success is someone using a new sterile pipe to inhale their substances and helping to prevent infectious diseases and things like that. Sometimes it's someone actually going to an appointment and following through on something. Sometimes it is getting someone set up with with housing and supporting them through that. But I don't even know if we would be able to give you a number of what that looks like because it is so diverse and it's so difficult to quantify. Because we ask the folks that we work with very, very regularly what they need, and then we do it. And that's why we work with peers as well, right? Like having folks from with. Increasing, yeah. And that's, I guess, again, like a really complicated thing to measure because there are so many other factors influencing what the folks that we work with, the challenges that they're facing and what we're trying to support them with. So the toxic drug poisoning crisis, right? Like the unregulated drug supply is something that R.0.C.K has no control over. We can hand out naloxone, teach people how to respond to an overdose until we're blue in the face. But until we have some things at the policy level to address that challenge, like we're gonna just keep having to do what we're doing.
And we can't control housing.
We
The
can't
housing
control.
market, the lack of housing resources. This is not, as you can see in Wallaceburg, in Chatham Kent, and then you watch the news. The housing crisis across Canada and North America, we're in a first world nation, are exponential because the disparity between those with access to services and income supports and connections is increasing, and the access to housing is decreasing. The housing that is there is becoming unaffordable, even for the persons that are even low income. We are seeing more people that are living in their cars, and but the difference is that we're now finding them. They're not. We're accessing and finding them and supporting them in their cars. And these are people that had full-time jobs and pensions. I am seeing an increase both at the hospital and with R.0.C.K of persons with pensions that are unable and are houseless now.
Good.
Yeah. Yeah, our social housing in Chatham Kent. So Chatham Kent, so the geared to income social housing, the wait is between 5 and 8 years for a 1-bedroom. Okay, and we're okay taking questions, right, and gentlemen? Yes.
But one of the things I've heard bring up a couple of times is that individuals with substance abuse feel like they can't trust the healthcare system.
And that is,
yeah. Why would that be?
Stigma.
And also understand that to be a healthcare professional in Canada, you're under oath to get everyone the same kind of treatment.
Yeah, and I promote that in the staff that I work with at the hospital every day. But everybody brings their own upbringing, their own way they think about things, and it does interrupt their professionalism. And I apologize. It shouldn't. You're right. I agree. I hear you. It hurts. Even the way I practiced when I was 20 years ago to now, I will tell you, I'm different. It doesn't make sense. Yeah. 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 And I mean, it comes from like when a person, I think I've seen people come to the hospital when they were young, and if you get treated poorly once or twice, you lose that trust, right? And so that's why R.0.C.K is trying to, and with peers, we're trying to give you a new place and then rebuild that trust with the healthcare system, and we're trying to change it. We are. But yes, we need, what I want to go back to is what is on the thing. keep having conversations with their friends and family. So we're raising and promoting a healthcare system that will embrace all individuals, that your OHIP card is welcome and you are welcome to come in the doors and you're going to get the same treatment. It should, but it's interrupted. The trust has been broken and we need to do better. You're right. We need to do better. Okay. I absolutely, yes. Training, trauma-informed training, training like this for our hospital setting. We've done it a couple times. We need to do it more because it's a lot of staff. Yeah, no problem. And I could talk it for this whole night. She has a question.
Condescending. I've witnessed everything from roughhousing to condescending treatment. I know for a fact that when they do go into the ER, we also have mobile vans for medical care, and the unhoused refuse to go there too. It's a look, it's a word, it's and they feel judged. So I think the training has to. When I was a nurse, it was ingrained in us that you treat everybody coming through that front door the same. The rich were treated the same as the poor, the dirty the same as the clean. But somewhere along the line, nursing, doctors, whatever, have lost that. And they do judge. Pardon me? They are taught that, but somewhere along the line, it's not happening. I've seen it in the ER in Windsor. I've seen it. Yes, it's wrong. So if you see it happen, you need to report it. There's patient advocacy that you can report it to. And I agree with you guys that you need to do more training within the hospitals at the staff level to have them have an understanding of how they can reduce the stigma. In answer to your question about is it being successful, the fact that they have people walk through their door and they can say that they've got people, what did you say, 50 walk through your door? Yes. The fact that there are those kinds of numbers walking through the door trying to look for some sort of help is proof enough that what they're doing is working. The housing is set up for failure. There is not the sequential steps of housing to bring someone who is unhoused right straight into normal housing. There has to be about 4 or 5 stages of kinds of housing that they have to go through, and it's not set up. So social housing is meant for just someone who has been down on their luck and has maybe been on the street because they lost their job, but they don't have a mental illness, they don't have a drug addiction, they don't have any complicated problems like that that have to be dealt with first before they're put into a normal type of housing. So if you want to advocate for anything, advocate for, supportive housing and some going straight from detox to supportive housing, then supportive housing to transitional housing. Those kinds of stages need to be set up in order to successfully bring people with these kinds of problems off the street. Yes? Oh, sorry.
Hello, yeah, excuse me. I just wanted to quantify that. It's 100% true. To quantify my recovery, I had a roof over my head. I had food in the fridge. So I had a major advantage to beginning my journey. And as far as success rate, fortunately, recovery as such, most programs, it's anonymity because not a lot of people want other people to know that they are in recovery. Me, I'll wear my recovery on my sleeve just because I believe people have to know what it is like to be where I was. So that's it.
But you bring up an important piece that there's a lot of hidden substance use, especially with working professionals, that our peers will tell us. We know who is at who and whose door getting whatever. But I also wanted to say, like, it's not just medical, right? It is across all of society, the stigma. I have a brother-in-law that's a volunteer firefighter, and he struggles responding to those calls where someone's down. And he's just like, Jen, she's not gonna make it one day. Why are we bother going out there? And I'm like, Dean, it's your job. You can't judge. Just please get there on time next time. And it's exhausting. It's burnout. I have a sister who is an ER nurse in Windsor, and she's burnt out, and I can see it. It comes taxing on a person. So we do need to train. And it was school teachers. It's across all systems, right? With CAS workers, children's services, all those pieces, what we see, how we view, wanting to train workers around mothers who use substances. Was I ever judged for how much wine I drank while I was raising my children? But I have friends at Rock will tell me stories how their children are ripped right from them. And is that fair?
I'm also going to just shamelessly plug when we're thinking about the healthcare system and our other emergency social services, those spaces, and how folks who use substances or experiencing houselessness are treated. Substance use is one of the only things that when you're seeking help, you actually have to stop being sick before you're allowed to receive the help, right? Like a lot of our treatment services are set up in such a way where you have to stop using substances before you're even allowed to go get the treatment for the thing that you're asked. Like, how does that make sense? It is one of the most underfunded health issues in our system. Like psychiatrists, so physicians that work in the field of mental health and substance use are like the lowest paid physician on the pay grade, right? Like there are bigger reasons why the care that is available for people who use substances is not meeting their needs. And I would say that politically speaking too, like our parties, platforms, like when you are voting, if you care about these issues, look and research the party's platform and what they are committing to and what they are doing about substance use, about healthcare, and about housing and houselessness, because the government that we have in place right now, the provincial government, is what mandates healthcare and housing. The policies that they are putting in place are going to set us back decades. So that is another action that I would recommend that you can take as an individual, right?
Oh, okay. I just like that. I do volunteer at other organizations and in different locations. And one of the issues is, speaking of housing, okay, somebody does decide that they want to get sober or clean. They go to detox. They go to a recovery home. Now, where do they go from there? Back to where they came from. I mean, if they're going to go back into the same situation that they're trying to escape from, it doesn't matter what help they try to get, if they're going to end up in the same situation again. So unfortunately, it's an endless circle, even if they do try to get help.
Okay, we have a few. So I'm just going to do just a time, like we'll do the questions. I'll do a time piece. I know there were some more items on our agenda, but in the sense, I think the conversation is going well. And there was one piece, but it's around acknowledging, knowing what a substance poisoning, opioid poisoning looks like. We could take that out to whoever is interested or anybody who wants to understand or want to learn a little bit about naloxone. We can do that afterwards, and who wants to do that piece can stay back and behind, and we'll walk through that individually.
I would like to address the housing issue once again, but also my initial question about how do we equip ourselves to see people who society sees as the not good enoughs and see them as good enough. I was 5.5 years volunteer chaplain at the Compass in Mississauga. I've just retired and come here. And one of the things, and it was very much on a larger scale of what R.0.C.K is here. And so all of the same issues. One of the housing issue, Indwell, we worked with Indwell. And I was in Clarkson, so they were going to have a build in Clarkson. And word got out, and so there was a large community gathering, and the opposition was unbelievable. And the vileness and the velocity of the anger that people who have already addressed addiction issues, who are now meagerly employed but still need housing, the opposition to Indwell building was just unbelievable. And one of the things that I'm also a minister, so in my being with people, if you have money, you can have all the addictions you want, because you can always find resources, right, to help you deal with your addiction. But if you don't have money, you're not good enough. And that was my question. How do we equip ourselves to go from feeling that people are not good enough to letting them build housing where we live, not in my backyard? That was the attitude. So, and I get angry, so I apologize for being angry.
We love anger.
We embrace all emotions here, all emotions, because none of them are wrong. And I think that's where we start with the piece to answer your question. You being a minister, anybody here, everybody here tonight is because they're from this community. Okay. The answer is being community. And I'm being community, whether I'm being community with Jennifer or you, but the fact that you're here, you wanted to know about R.0.C.K. We serve humans. You are humans sitting there, and we're just going to treat each other the best we can, no matter what, our income or anything else. But know that we all bring something to this world. So we're just about compassionate approaches. And it starts with us. It starts with being kind. You don't have to help everybody, but the ones in our immediate circle are great. The one in our street, as best you can, as long as you feel safe doing so, being present. I know persons in mental distress, or if they're using substances sometimes, yes, it appears very scary. But sometimes it is making eye contact and a gentle approach and just say, hey, is there something you need? Can I help you?
So I'd like to share a personal experience I had with the Wallaceburg R.0.C.K. I'm a very active member of the City Hand Community Curling Club, and we held a breakfast. We had a whole lot of stuff left over. And it would have been absolutely a crime for that to be just thrown out. And I took it down to R.0.C.K, and please, Miss Healthcare Lady from the ministry, whatever, it was very sanitary, but it wasn't perfect, okay? And those ladies accepted it, and I spent a few minutes just delivering it, and I knew it was going to street level help. So you're absolutely right. We can all help in some way. And it just took, all of a sudden, I don't know why, I just said, I'm going to take that to R.0.C.K. And amazing. So what I would like to say is you need to continue to get the message out, what R.0.C.K does, what R.0.C.K needs, and bring it onto the front page. And that's my experience.
Thank you. So that's actually a part of the conversation. We need you to continue these conversations. So with what, hopefully you've learned something this evening, and we can even dive in deeper if you want some tangible things to still walk away with, because I know we didn't get to your question about the backyard. And a lot of it is you have to do what's safe for you. So if you have to call police, you need to call police. If you're the homeowner and someone is squatting, you will have to understand your rights and do the trespass process. There are community officers, that is solely their role, to support individuals through that, to educate you what you need to do. And we work really closely with those community officers. They come into the Rock House. They help us out if we need to ask questions, so our friends know answers to. But a lot of what we shared tonight, we need you to take these conversations home to have with whoever is in your circle, who then hopefully will share, or if they want to invite us in, we'd love to go and share. And we do have various different trainings. And this is the stigma one. We go even more in depth. We do harm reduction trainings to understand the supplies, the resources we take out, especially the impact it has on the healthcare system. We also have naloxone training, or actually not training, like a awareness of how to use it so people are very comfortable with it. But a lot of the ROC conversation needs to start from here and go out into the community, and we ask you to take that role and do that for us.
There was one more question too from somebody back here. I want to make sure that we do.
Hi, I just have a question. Since, I mean, we have a drop-in center, and is there any kind of educational component while they were there? You know, like someone mentioned the fact that if your life is in your backpack, but, you know, if you set it down, someone might take it. So could you not be running videos sort of like, you know, what's mine is mine, and trying to send out the message that, you know, that maybe you shouldn't, people that you are with there, you might take something that belongs to them. Is there, you know, can you not sort of educate people? And I mean, I actually know someone who twice his business has been broken into in the last 6 weeks. And he was a person that has always been very supportive of all kinds of, you know, like different, I mean, actually Hope Haven and Chatham and a lot of things. Well, you begin to get discouraged if people are continually taking from you. So, I mean, is there no opportunity to sort of put those messages out through videos or whatever while people are sitting there? I don't know. It just seems that maybe there's some kind of education might be.
Yeah, thank you for the suggestion. Anybody want to tackle that one? Yeah.
I say, unfortunately, in society, but I don't think we can paint everybody with the same brush. If there's a couple bad apples in everywhere, I don't care where you go. It just so happens that these happen to be people, the friends of ours, however you want to phrase it. But it's because there's a couple of bad ones. We can't paint them all with the same brush.
And I'm sorry to hear about your friend that had their business broken into. That sucks. And that's not right. And those concerns are totally valid. We have also had stuff stolen from Rock many, many times. I think if I try and walk alongside our folks that are taking things that don't belong to them, they're often living in the now, in the immediate, and don't necessarily have the same capacity as you or I to think about the long-term impacts of those actions. So they're doing something to try and survive and get through the moment that they're in, and they have a need, and they're trying to survive in the best way that they can. And sometimes that ends up affecting other people. And that's tough. That's tough. As far as the education goes, we do lots and lots of health teaching, capacity building, skills work with people when and however they are ready and however that makes sense for them. So it's a very person-centered, individualized approach. And I think a lot of that comes from the peers too. And I think sometimes the best education is when, like, Sean can drop an F-bomb with somebody and tell them to stop taking my blah, blah, blah stuff, when I can't do that, right? But when it comes from someone within their community, it has a little bit more weight. It means a bit more. Sam also drops a mean F-bomb. She does that really, really well. Yeah, I think we're at our time that we had committed to for tonight, but happy to stick around if folks would like to chat a bit more about overdose response and naloxone, or if you want to come chat one-on-one with us. If you have any questions, can certainly chat more about your situation too. Happy to do that.
Yeah. So those are the resources. They're out on the tables. Also, no, we were talking about volunteering and our needs with R.0.C.K in our community. Again, any of us can answer those questions, so feel free to approach any of us. Sam really likes to answer questions, as you can see. But yeah, any of us would be happy to answer your questions, and some of us have name tags. Lori wants to say something.
I just want to say it's super important for everyone to know that R.0.C., Wallaceburg, and Chatham, doors are open for anybody. You don't have to be going through a rough time, or you can come in, have a coffee, talk, anything like that. We serve everyone, not just those suffering with substance abuse issues or homelessness. We serve everyone. I think that's important.
It is true that both centers are welcoming. We have neighbors in both environments that come in. It's again, low barrier, no judgment. Anybody can come in. Thank you for inviting us.
Wallaceburg is 1 to 5, except for Wednesday is the only day they're, and Sunday. Wednesday and Sunday are the only days they're not open. Otherwise, they have open doors 1 to 5. And there's always 2 staff there.
I just wanted to thank everybody for coming and let you know that part of the genesis of this was because I had an encounter downtown. And much as I consider myself a pretty compassionate and caring person, I realized I had no idea what to do. I had no idea even how to be compassionate in that situation. And so I started reaching out and landed on R.0.C.K and said, do you do training? Do you know how we could be better neighbors? And it's really awesome to see so many people here. And I'm just curious. We did not get to hardly any part of this presentation. We have a lot of questions to still answer. How many of you would come back and continue this conversation? So I think Deanna and I are going to add that to our list, and maybe we can make this a recurring meeting and bring your friends and really start to make this a better community. But now we can have better community with treats outside and coffee and continue this conversation. And everybody here will be happy to talk to you one-on-one. And we'd love to know what kind of questions you have that you would like to hear us talk about here again. So thank you all.